Hello there, sir. Dale's my name. I'm one of the on-call house surgeons
Oh,
tonight.
right.
I was wondering
Dale.
if I could speak to you about Elaine, who I understand is your mother. Is that right?
Yeah, that's right.
Yeah. So what's your full name?
It's Keith Marshall.
Keith. I was just wondering if we could have a chat about your mum, because we're quite concerned about her condition at the minute. I was wondering, is there anyone else that you'd like to be present for this discussion?
Well, no, I've got a sister, but she's up in Auckland, so just me for now.
Is there anyone else that you'd like to be present? We have a support service in the hospital, the family support and chaplaincy service. Would you like anyone as a support person?
No, I'll be fine.
Okay. Right. Can you tell me, first of all, in your own words, what's your understanding of your mum's situation at the moment?
Well, she's living in a rest home and she's been falling over quite a lot recently, and I think she had a bit of a big fall today, and so they think she might have broken her leg or a hip or something. So brought her in here to check it out.
Yeah. And in terms of information, how much would you like to know?
Oh, I think I'd pretty much like to know everything.
Yeah.
My sister's going to want to know it all.
Yeah. Okay. So certainly you're right in that your mum has broken her hip. She's fallen today and broken her hip. We're also concerned that she has a pneumonia, an infection of her lung as well. And some of the blood tests and observations suggest that this is quite severe.
That sounds pretty serious.
It is serious, or certainly it can be serious. What are your biggest worries about her health?
I think I'm most worried, I guess, that she's going to not get better. Yeah. She's kind of been forgetting things a lot lately and kind of struggling to know who she is and where she is. So, yeah.
Okay.
Be worried if it got kind of worse.
Yeah. Can I ask, what are your biggest worries about your mum's health?
I guess that she won't remember us. She's having a lot of trouble remembering as it is. And I think it's quite important for us as a family. We've been quite close. So her not remembering stuff would be quite a worry.
Yeah, if your mum's health worsened, what do you think would be important for her?
Oh, family, for sure. Me and my sister, and probably not to be in pain.
Yeah, okay. I'm hearing from you that family is important to both your mum and yourself. In terms of moving forward, are there any things or abilities that your mum couldn't live without, do you think?
Music. She loves to sing. She loves to dance. Yeah, she's always been about the music.
Yeah. Okay. And if things were to worsen, what do you think she would want to do to gain more time, if time were to become short?
Oh, that's a hard one. I think she'd be right for an operation. She's had operations before, but I know she's talked to her GP. And they've had a discussion about, if things got really bad, she wouldn't want to be on a machine or have tubes or be in ICU.
Yeah. Okay. Right, Keith, if I could just summarise what we've talked about so far. We know that your mum has broken her hip. We're taking her to surgery tonight to fix that. She's also got a chest infection that's quite severe, which we're treating with antibiotics at the moment. I worry that even with the operation and the antibiotics, that things will continue to deteriorate, and that if we use aggressive methods and interventions to try and bring her back, that we'll leave her much worse off than before. I wonder if we could talk about what we should focus on if that was to be the situation.
As long as it wasn't affecting her memory. That will be important.
Yeah. I hear what you're saying. Certainly in terms of the interventions that we would recommend in this situation, I think that treatment with a breathing tube and a ventilator in the intensive care unit would likely be more harmful than beneficial for your mum in this situation. And certainly our recommendation would be consistent with what I think you've told me about what her wishes would be, and that we would have her on the ward with antibiotics and fluids as appropriate. But if things were to continue to worsen, that we would focus on her comfort, making sure that she's without pain in that situation. We would allow her to pass away naturally. And that's a lot to take on board.
But I don't really want to lose Mum, but I don't want her to be in pain either.
Yeah. I think the risks of that with the aggressive interventions are such that they wouldn't be appropriate, to be honest.
Okay. Thanks, Dan.
Okay, Keith, I know these conversations are difficult, but thank you for taking the time. What's the best way to contact yourself? We'll obviously keep you updated as things progress.
I'll have my cell with me, so just give me a call on my cell.
All right. And with regards to your sister, would you like to call her, or would you like me to update her over the phone?
Oh no, I'll do that. Yeah, no, she'll need to know this.
Okay. Yeah. All right. As to where to from here, I'll go and talk to the consultant surgeon who's on tonight, and he'll pop in and see you later on. We'll keep you updated on a regular basis. Okay. If you have any questions for us, you can let the nursing staff know, and one of us will come and see you. Okay. And if anything changes and you're not here, we'll be in touch. Okay. Do you have any further questions for me at this point?
Not right now. It's kind of a lot to take in, but
Yeah,
thank you.